Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Extract 1, questions 1 to 12. You hear a gastroenterologist talking to a patient, Mrs. Johnson. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hi Mrs. Johnson. How are you doing today?
Hi doctor. Not too great, to be honest. I've been having a lot of stomach pain, and I'm really worried it might be ulcers.
I'm sorry to hear that. Can you tell me more about the pain, and any other symptoms you've been experiencing?
Sure. The pain is a burning like in my upper abdomen, especially after I eat. It's been going on for a few months now. Sometimes it gets so bad that it wakes me up at night. I also feel really bloated and nauseous, and I've lost my appetite. I think I have lost some inches, though. I haven't checked my weight recently in the past 3 months.
That sounds very uncomfortable. Have you noticed anything specific that seems to trigger the pain?
Initially it was difficult to know that, because it felt just like a simple indigestion, and I did not take it seriously enough, but gradually it started getting bad over a few weeks. It is then when I started to have a closer look at what's happening and tried to make a note of what I ate. Then I found spicy foods and coffee seem to make it worse. Stress also seems to play a big role. When I'm stressed out, the pain gets more intense.
May I know? What do you do for work?
My job can be pretty stressful, especially with all the deadlines and targets I have to meet. I am a sales manager.
Have you had any previous medical conditions or treatments for your stomach issues?
I've had acid reflux in the past, and my doctor prescribed me antacids and omeprazole. They helped for a while, but the pain always comes back. I've also tried over-the-counter medications, but they don't seem to do much. I did follow up with my GP. He used to change my medication. It used to get better for a while and used to come back. And then, about a year ago, I had an endoscopy, and the doctor found some inflammation in my stomach lining but no ulcers at that time. They recommended I continue with the proton pump inhibitors, but now I think things have gotten worse.
Do you have any family members with similar stomach issues or ulcers?
My father had ulcers when he was around my age. Later it was found that he had stomach cancer and passed away a year after that. And my younger brother has been dealing with acid reflux too. It seems like stomach problems run in the family.
Family history can definitely be a factor. Let's do a thorough evaluation to better understand your symptoms and any potential complications. We'll then develop a personalized treatment plan tailored to your needs. Does that sound good?
Yes, that sounds good. I'm ready to get to the bottom of this.
Great. During the evaluation, I'll review your medical history, conduct a physical examination, and possibly order some tests, such as another endoscopy or a urea breath test to check for H. pylori infection, which is a common cause of ulcers.
That sounds like a good plan. I appreciate the help. Can you tell a little bit about the infection you mentioned?
Definitely. Helicobacter pylori, called H. pylori, is a type of bacteria that infects the stomach. It's quite common. Most people with H. pylori infection don't show symptoms, but it can cause issues like gastritis, that is inflammation of the stomach lining and peptic ulcers, which is painful sores in the stomach or upper part of the small intestine. Now, we'll also discuss dietary changes and stress management techniques, since those seem to be significant factors for you. Making small adjustments to your diet and finding ways to reduce stress can help improve your symptoms.
I'm willing to try anything that might help.
Together, we'll create a comprehensive treatment plan that includes medication adjustments, lifestyle modifications, and stress management techniques. I would suggest you start practicing mindfulness meditation, which can help cope with stress.
End of Extract 1. Now look at Extract 2. Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Sam. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hi Sam, what brings you in?
Hi, I've had this pain on the outside of my right elbow. I first started noticing it several months ago. I didn't bother since I thought it will go on its own. But recently it's just been more painful.
Was there any sort of trigger, trauma, anything like that to that area?
There wasn't any trauma or any triggers that I noticed. I was just having feeling the pain a bit more at the end of work.
Okay, does anything make it better or worse, the pain?
Yeah, if I'm just resting the elbow it makes it better, and I've tried things like ibuprofen, which has helped with the pain. I'll do that hoping I can get through work sometimes if the pain is bad enough.
Right, okay. And if you were to describe the quality of the pain, is it sharp, throbby, achy?
Well, it's achy and then sometimes depending on the movement it can be sharp as well. Mostly the movements at my wrist. If I'm bending my wrist down, I can feel it, or if I'm having to pick things up or hold heavy objects at work. I do a lot of repetitive things at work.
Can you give any other details about your condition?
Yeah, sure. I feel the pain is getting worse over the past few months. I tried some stuff like topical ointment that you can get at the drugstore and it did help take the edge off a little bit. Despite of the pain, I have full range of motion of both the elbow and hand. I've been able to manage so far at work, but it is starting to become an issue with my job lately. I did not experience any numbness.
Now I am going to get you to extend your wrist. And then keep your elbow in full extension as well. Does that hurt?
It does hurt, yeah.
Does anyone in the family has skeletal or muscular problems?
I remember my dad used to take some medications for that joint condition that is called rheumatoid. He did struggle a bit with pain and doing things with his hands. He had to give up his work. He was a mechanic. Other than him, all were fine.
Do you smoke or drink alcohol?
I haven't smoked before, but I'll have a glass of wine every once in a while, but maybe just one a week.
I think those are all the questions that I had for you. Did you have any questions of your own for myself?
I was just wondering what this pain could be in my elbow.
Yeah, so right now it seems like you may have a case of something called lateral epicondylitis. So it's also known as tennis elbow, and there are a lot of things that could kind of predispose you to this, so it could be like the repetitive strain at work. So for this we basically recommend a couple of things to manage the pain. But first, like in terms of imaging, I don't think it is necessary because it doesn't seem like there was any trauma, and I'm not too worried about any fractures. So to help you treat this, we recommend some activity modifications, so at work not doing things that are too repetitive, especially if it's using those extensor forearm muscles. And then you can use a compression sleeve as well, continue taking Tylenol for the pain, and really important is physical therapy to increase mobility and strength in that arm. And as well you can apply things like ice to it for like the pain and swelling if you see any. So it should resolve in about 6 months to 2 years at most, but normally it does go away in a couple of months with some physical therapy, and the compression and splints if you choose to do that. How does that sound?
End of Part A. Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nurse briefing her colleague. Now read the question. Hey, just wanted to update you on Mr. Peter in room 202. He's still experiencing some fatigue, but that's expected at this stage. We're encouraging him to rest and gradually increase his activity levels. He's still experiencing fever. He was given paracetamol infusion twice today. His antibiotic therapy was also administered as prescribed. Today was his 4th day of treatment and I wonder whether antibiotic need to be reviewed for its effectiveness. We'll need to continue monitoring his fluid intake. Amongst all this, one silver lining is that his family has been very supportive, which is helping his morale. Regarding his diet, he was able to have some soup and bread this morning, though his appetite needs to be improved. Question 26. You hear a manager talking to hospital staff. Now read the question.
Good morning, everyone. Thank you all for taking the time to be here today. As we continuously strive to provide the highest quality of care to all our patients, it's crucial that we remember the importance of inclusivity and respect in our daily interactions. Today, I want to address the care of our transgender patients, who, like anyone else, deserve our unwavering support, understanding, and empathy. Transgender individuals often face unique challenges when seeking medical care. They may experience anxiety or fear due to past negative experiences, or the potential for discrimination. It's our responsibility to create a safe and welcoming environment for them, where they can receive the care they need without judgment or bias. Always use the patient's preferred name and pronouns. This small act of respect can significantly impact their comfort and trust in our care. If you're unsure, it's okay to politely ask the patient how they would like to be addressed. Protecting the privacy of our transgender patients is paramount. Avoid making assumptions about their medical history or sharing their personal information without consent. By fostering a culture of inclusivity, compassion, and respect, we can ensure that our transgender patients receive the dignified care they deserve. Together, let's make our hospital a place where every individual feels valued and supported.
Question 27. You hear a physiotherapist talking to nursing staff. Now read the question.
I wanted to take a moment to discuss a crucial aspect of our patient care. Hoists are essential tools that help us safely transfer patients, especially those with limited mobility. However, when used improperly, they can cause harm, including falls, injuries, and discomfort for our patients. It's also important to note that incorrect use of hoists can lead to workplace injuries for our staff, such as back strain and other musculoskeletal issues. Recently, we've noticed a few instances where hoists were not used correctly, and this can lead to serious consequences, both for our patients and for our staff. Before using a hoist, always check that it is in good working condition. Look for any signs of wear or damage and report any issues immediately. Proper maintenance is crucial for the safety of both patients and staff. Whenever possible, work as a team when using a hoist. Having an extra pair of hands can provide additional support and ensure the transfer is smooth and safe.
Question 28. You hear a trainee nurse talking with senior nurse. Now read the question.
As a newcomer to the healthcare field, I have a lot to learn and a lot to adapt to. I want to make sure that I'm performing all my tasks correctly, from administering medications to monitoring vital signs. Every action I take can have a significant impact on a patient's well-being, and that responsibility weighs heavily on me. I'm constantly double-checking myself to avoid making any mistakes that could harm my patients. In addition to this, I'm also concerned about effectively communicating with my colleagues and patients. Clear communication is essential in healthcare, and I want to ensure that I'm relaying accurate information and instructions. I worry about missing important details or not being understood, which could lead to complications in patient care. However, the most pressing issue for me is that I am making mistakes while calculating dosages of chemotherapy drugs. I wanted to let you know, and I appreciate any support from you to overcome this.
Question 29. You hear a manager of nursing home talking to staff. Now read the question.
I wanted to take this opportunity to reflect on how we managed recent food poisoning outbreak. When the outbreak occurred, it was a challenging and stressful time for all of us. However, your immediate actions and unwavering commitment made a significant difference. From swiftly identifying the symptoms and isolating affected individuals, to administering the necessary medical care and maintaining clear communication with families, you all demonstrated exceptional teamwork and resilience. I'm particularly impressed by how you managed to provide compassionate care to our residents during this difficult period. Your calm and reassuring presence helped to alleviate their anxiety and discomfort. Your ability to remain composed and focused under pressure is truly commendable. Moreover, the way you coordinated with the health department and adhered to infection control protocols ensured that the outbreak was contained and managed effectively. Your vigilance in monitoring the situation and your thoroughness in sanitizing the facilities were instrumental in preventing further spread.
Question 30. You hear a patient talking with ophthalmologist. Now read the question.
Good morning, doctor. I've been experiencing redness and irritation in my eyes for the past few days. They are also watery and itchy.
I see. It sounds like you might have conjunctivitis, also known as pink eye. Have you noticed any discharge from your eyes?
Yes, there's a sticky discharge, especially in the morning. My eyelids get stuck together sometimes.
That's a common symptom. Conjunctivitis can be caused by various factors, including bacterial or viral infections, allergies, or irritants like smoke or dust. Have you had any recent illnesses or allergies?
I did have a cold last week, and I've been sneezing a lot recently. I also have a history of seasonal allergies.
Given your symptoms and recent cold, it's possible you have viral or allergic conjunctivitis.
Okay, doctor. What's the treatment for conjunctivitis?
Treatment depends on the type. If it's viral, it usually resolves on its own within a week or two. You can use cold compresses and artificial tears to ease discomfort. Avoid touching your eyes and wash your hands frequently to prevent spreading the infection.
That is the end of Part B. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Kelly about irritable bowel syndrome. You now have 90 seconds to read questions 31 to 36.
I'm really pleased to be joined today by Professor Kelly, who's going to be talking about her work looking at treatments for irritable bowel syndrome. Professor, could you talk a little about the burden of IBS and also the options available to general practitioners who see patients with the condition?
IBS is, or irritable bowel syndrome, is a common condition, and it is what's known as a functional gastrointestinal disorder, or more recently, these conditions have been relabeled as disorders of gut-brain interaction. So these are disorders that are incompletely understood but probably relate to complex multifactorial pathophysiology involving abnormal communication between the gut and the brain through the enteric nervous system. IBS affects between 5 and 10% of people living in the community. Not all of those people will consult a physician as a result of their symptoms, but probably 30 to 50% will see their GP because of symptoms, and IBS is a financial burden to the health service. General practitioners use what we call first-line therapies as they are not equipped to utilize more advanced treatment forms, and they tend to include soluble fiber, antispasmodics, antidiarrheals.
That's very informative, Professor. Could you elaborate on why these disorders are now being classified as disorders of gut-brain interaction?
Certainly. The term disorders of gut-brain interaction reflects the growing understanding that IBS and similar conditions are not just localized to the gut but involve complex communication pathways between the gut and the brain. This interaction involves neural, hormonal, and immune signals. Essentially, the brain and the gut are constantly in dialogue, and disruptions in this communication can lead to the symptoms experienced in IBS. This reclassification aims to better capture the multifactorial nature of these conditions and improve the approach to their treatment. One should not get confused about treatment options because of this reclassification. The standard treatment for the condition is still largely the same.
That's fascinating. You mentioned first-line therapies like soluble fiber, antispasmodics, and antidiarrheals. Could you delve into how these treatments work?
Absolutely. Soluble fiber helps by forming a gel-like substance in the intestines, which can regulate bowel movements and ease symptoms like diarrhea or constipation. Antispasmodics are medications that help relax the muscles of the gastrointestinal tract, reducing cramping and discomfort. Antidiarrheals, as the name suggests, help control diarrhea. These treatments are generally well tolerated and can provide significant relief for many patients. However, they address the symptoms rather than the underlying causes, which is why more advanced treatments are sometimes necessary. If you ask me, I always prefer to treat my patients with soluble fiber simply because it is inexpensive and has no serious adverse effects on the patients. Whereas many of my colleagues favor using antispasmodics, citing various advantages, however, I disagree.
I see. What are some of the more advanced treatment options for IBS?
For patients who don't respond to first-line therapies, there are several advanced options. These include medications that target specific symptoms or mechanisms, such as antidepressants, which can help modulate pain perception and gut motility. There are also newer medications that target serotonin receptors in the gut, which can regulate bowel movements and pain. Additionally, psychological therapies such as cognitive behavioral therapy, CBT, have been shown to be effective, as they can help patients manage stress and anxiety, which are often linked to IBS symptoms. Treatment with antidepressants comes with cost. Some patients develop insomnia, skin rashes, headaches, joint and muscle pains. If they take these medications along with aspirin, then they are at slightly increased risk of internal bleeding.
It sounds like there are many avenues for treatment. Are there any lifestyle changes that can help manage IBS symptoms?
Yes, lifestyle modifications can play a crucial role in managing IBS. Dietary changes, such as adopting a low FODMAP diet, can help reduce symptoms by eliminating certain carbohydrates that are poorly absorbed in the gut. However, making any changes to diet is a complex process and highly individual, where each and every person has to try and eliminate certain foods from his diet. One more thing to keep in mind about any dietary changes is how is it going to impact an individual's overall health and nutritional status. It is always a matter of considering risks versus benefit, and ensure benefits outweigh the risks. Apart from dietary interventions, regular exercise and stress management techniques, such as mindfulness and relaxation exercises, can also be beneficial. Keeping a symptom diary to identify and avoid specific triggers can help patients gain better control over their symptoms.
Thank you, Professor Kelly. This has been incredibly enlightening. Before we wrap up, is there any advice you'd like to give to individuals living with IBS?
Managing IBS can be a challenging journey, but it's important to remember that with patience, persistence, and the right approach, you can effectively manage the condition. Building a strong, ongoing relationship with your healthcare provider is crucial. They can help tailor a treatment plan that's specific to your needs, and it's essential to remain open to trying different treatment options until you find what works best for you. Lifestyle changes can also play a significant role in alleviating symptoms. Moreover, connecting with support groups can offer invaluable emotional and practical support. Sharing experiences with others who understand what you're going through can provide comfort and encouragement. Patient education resources, such as books, reputable websites, and informational sessions, can also help you stay informed about the latest treatments and management strategies for IBS. Overall, it's important to maintain hope and resilience.
That is the end of Extract 1. Extract 2. Questions 37 to 42. You hear a presentation from audiologist Mr. Jack about hearing loss among children. You now have 90 seconds to read the questions.
Thank you for joining me today as we delve into the important topic of hearing problems among young children and the experiences of their parents. The journey of discovering, understanding, and managing hearing loss can be a challenging one for both children and their families, but with early detection and appropriate intervention, significant strides can be made in improving their quality of life. Hearing problems in young children are more common than many might think. These issues fall under the category of functional hearing disorders and can significantly impact a child's ability to develop speech, language, and social skills. The lack of awareness among parents about pediatric hearing losses has allowed numerous children with hearing impairment to go unserved or underserved in their educational setting. Early detection is crucial, as it can pave the way for timely intervention and support. A common misconception is that pediatric hearing loss is a low-incidence disability. This misconception is based on the historical tendency to equate the term hearing impairment only with severe to profound bilateral hearing loss. A hearing loss, first and foremost, interferes with a child's detection and recognition of speech. In the case of a sensory neural hearing loss, it may both filter and distort sound, or in the case of a conductive loss, it may cause fluctuating hearing levels. In either condition, the development of auditory skills that are prerequisite to the development of receptive and expressive language skills, as well as speech intelligibility, are delayed. Such auditory skills include detection, discrimination, recognition, comprehension, and attention. In turn, a delay in the early development of auditory skills caused by a hearing loss negatively impacts a child's ability to learn and use an auditory oral language system. The impact of a child's hearing loss extends beyond the child to their parents and families as well. The emotional journey for parents often begins with shock, denial, and sadness upon learning of their child's diagnosis. Parents face numerous challenges, including communication barriers with their child and the complexities of navigating the healthcare and educational systems. Balancing the needs of the child with other family responsibilities can also be overwhelming. However, with the right support and information, they can develop effective coping mechanisms. Many parents find solace in joining support groups to help navigate this new path. Despite these challenges, many parents have experienced positive outcomes. Success stories of children using hearing aids or cochlear implants often highlight significant improvements in communication and social skills, thanks to early intervention. Now let me talk about a case, a 2-year-old child named Audria. She used to get ear infections few times a year. She was regularly seen by her GP and managed her with topical antibiotic ear drops. However, her GP, concerned about complications, referred her to see ENT specialist. It is then she was diagnosed with conductive hearing loss due to frequent ear infections. Her parents were heartbroken to find out that their condition was made worse by the fact that, if she had consulted with specialist earlier, the outcome would have been very positive. However, through regular checkups, ear tube surgery, and the use of hearing aids, the child's speech and language development improved significantly, showcasing the importance of early intervention. Another case involves a newborn. When Gemma gave birth to Maggie, she never expected her daughter would have hearing loss. She failed 2 hearing tests in the hospital and nurses thought it was most likely due to fluid in her ears, but just to be safe we scheduled an auditory brainstem response test and audiologist that would determine whether it was fluid or something else. When tests came back that Maggie had severe to profound hearing loss, Gemma was devastated. The child received a cochlear implant, along with speech therapy and strong family support. This intervention led to successful adaptation to the implant and notable improvements in communication skills. Fortunately, the nurses and midwives were educated and trained to screen newborns for hearing, which lead to early detection of problem with Maggie. As we draw to a close, it is imperative to stress the crucial role of early detection and intervention in managing hearing problems among young children. Identifying hearing issues at the earliest stages allows for timely and effective interventions, which are vital for the optimal development of speech, language, and social skills in children. By addressing these challenges promptly, we can significantly improve the quality of life for affected children and their families. Ultimately, the goal is to ensure that children with hearing problems receive the support and resources they need to thrive. By fostering a supportive and informed community, we can make a significant difference in the lives of these children and their families. Remember, early intervention and a proactive approach can lead to positive outcomes and a brighter future for all involved.